Today we're going to examine the FHL, flexor hallucis longus, and this is Becky, one of our California Ballet Company dancers. So she actually has a really nice point, and kind of looking here at the foot. And of course you're going to test and ask about the history. You're going to inspect the foot to see if there's any type of swelling going on, especially in the arch or even in the posterior medial ankle. You'll go ahead and do palpation, and as knowing the tendon course, you'll start kind of at the tip here, the distal end, feeling underneath the phalanx, dropping down right in between the sesamoid bones where you have that tendon course, all the way through underneath the arch into the knot of Henry, and also palpating in that posterior medial ankle where you have the tendon sheath over that FHL tendon. When we look at the range of motion, we're going to look at the dorsiflexion of the injured phalanx all the way to plantar flexion and compare both sides. If you have a 10 degrees difference, then you can actually be able to put together there might be an injury in that FHL tendon. The other thing is that you'll test strength. And so a couple of ways that we do that is having the dancer crunch the toes, which never likes to happen in class. Go ahead and Becky crunch. And then what I'm going to try and do is actually grasp the distal phalanx and try to extend it or dorsiflex it up. Becky, resist me and ask where the pain is occurring. And so that might be, again, at the sesamoids, the knot of Henry, or posterior medial ankle. Of course, dancers don't do that, and they actually go through a demi-point, or they'll go ahead and point the toe for their function, or they'll be fully on the toe within point. And so you'll ask them, those three different motions will affect the pain and wear. And so again, checking for pulses, sensation, both in L5 and S1, and also appreciating for any type of swelling or bruising going on. The last the last test that we will do is just looking to help stretch that FHL. So Becky, if you can come over. So Becky is going to place her distal phalanx on top of this book. Keeping her heel on the ground, she's actually just going to demi-plie or just bend the knee, holding for 10 seconds, and then she'll go ahead and straighten the knee back up. And that really will stretch the entire FHL tendon. So do that 10 times, and she can repeat that 3 times throughout the day. Thank you.